Good afternoon, Andrew Taylor. Let's begin the warm-up session. Describe your ability to handle high-pressure situations.
I've always done well with deadlines and thrive in a fast-paced work environment. During my time at the urgent care clinic, I have helped numerous patients with illnesses, injuries, and health crises. One particular day, a mother brought in her young child, who had been quite ill. During the intake process, the child became unresponsive, and I had to think quickly and act calmly. I immediately began checking the child's vital signs, sent the other front desk worker to get the doctor, and began cardiopulmonary resuscitation, which I continued until a physician took over. The child was ultimately revived, and my ability to act quickly using the training I had acquired was an integral part of saving that child's life.
Where do you see yourself in 5 years?
In 5 years, I envision myself as a seasoned nurse, working in a challenging and rewarding role. I aspire to deepen my clinical expertise and leadership skills and to become a valuable asset to my healthcare team. I hope to be involved in mentoring and educating new nurses and to contribute to improving patient outcomes through evidence-based practice. Ultimately, I strive to make a positive impact on the lives of my patients and their families.
Do you think nurses should attend continuous nursing education?
Yes, I do. The Continuous Nursing Education Program helps nurses update themselves with the current practices in their profession. Moreover, nowadays, it is mandatory to have specific hours of continuing nursing education to renew the nursing registration. Hence, continuous nursing education is very important for nurses.
What do you find is the hardest part about being a nurse?
I think the hardest thing I've had to deal with is feeling helpless. While it's my job to provide as much care and comfort as medically possible, there are times when I just can't do more. Seeing someone in pain or feeling miserable and knowing there's nothing you can do to help is the most difficult thing I deal with. I am a nurse because I genuinely care about people and want help, and when I can't, that's hard.
Describe your typical working day.
My day starts with prayer. After completing my daily routines, I reach my workstation by 7:30. Before taking the handover, I complete my inventories and update the crash cart medication and dressing trolley. After receiving the handover, I interact with my patients to identify their health needs. Based on my assessment plan, a nursing care plan, and provide quality care for my patients. Afterward, I assist the physician in his work and carry out necessary clinical orders. Meanwhile, I find some time to interact with my colleagues and maintain a good rapport with them. My duty ends by 3:30 after I give a handover to the next scheduled staff members.
Your preparation time is over. You can now start your roleplay.
Hello there. I can see you're not feeling well at all. My name is Andrew Taylor, and I'm one of the nurses here. I'm going to be looking after you for a little while. To start, could you please tell me in your own words what has brought you to the emergency department today?
Oh, thank you. I just started feeling really sick a few hours ago. I have this awful pain in my stomach, and I've been vomiting.
I'm sorry to hear you've been going through that. It sounds very unpleasant. Before we proceed, may I know your name, please?
My name is Mihiraa.
So, Mihiraa, you mentioned the pain and vomiting started a few hours ago. To help me understand your situation better, could you tell me more about how this all began? For instance, when did it start? What are your symptoms like now? And is there anything you've already tried at home to feel better?
Well, I had dinner out at a street food stall about 4 hours ago. About an hour after that, my stomach started cramping badly. Then the vomiting started. I've tried drinking some water and resting, but I can't even keep the water down, and the pain isn't getting any better.
It must be worrying not to keep even water down. Based on what you've told me, especially about it starting so soon after you ate out, it's very possible this is a case of food poisoning. This happens when the food or water we consume contains harmful bacteria or viruses. Your body is trying to get rid of that germ, which is what causes the vomiting and stomach cramps. Usually, for most people, the worst of these symptoms settle down within 24 to 48 hours as your body fights it off. Our next step here is for me to check your vital signs like your blood pressure, heart rate, and temperature. This will help us determine your priority level in the department. After I complete these checks, a doctor will come to do a full assessment.
What about treatment?
Let me explain what we can do to help you feel better, Mihiraa. The plan involves 3 key parts. First, because you're vomiting, we'll focus on rehydration with fluids given through a small tube in your vein, a 4-drip. Second, we have medications called antiemetics that work very well to stop the feeling of sickness and prevent vomiting. Third, we will address your pain management directly with safe and effective pain relief. This is the support we can offer you now. I know it's a lot of information. What part of this would you like me to go over again? Or what questions do you have for me?
The drip sounds a bit scary. How can I avoid this in the future?
I completely understand that the idea of a drip can be scary, and it's very smart of you to think about how to prevent this from happening again. Let's talk about that. For now, while you're recovering, the most important safety measure is to focus on good hygiene, like washing your hands thoroughly with soap, especially after using the bathroom. This helps prevent any germs from spreading to others in your household. At home, you'll also need to monitor yourself for signs of dehydration, which means watching out for things like feeling very dizzy when you stand up, having a very dry mouth, or if you notice your urine is very dark. If you experience any of these, or if your vomiting becomes more severe or you develop a high fever, it's crucial that you seek medical attention straight away. Looking further ahead to when you're feeling better and eating out again, there are some simple habits that can really help. It's generally a good idea to be cautious with high-risk foods like undercooked meats, raw seafood, or foods like mayonnaise-based salads that have been sitting out uncovered for a long time. A great tip is to try and check a restaurant's hygiene rating online before you go, and when you are there, trust your instincts about the general cleanliness of the place and the quality of the food you see. Does that advice for the future help put your mind at ease a little?
Yes, sure. I'll take care of it.
Thank you for your acceptance, Mihiraa. So, to move forward, the next step is for me to check your vital signs. This will involve taking your blood pressure, checking your temperature, and feeling your pulse. It's a simple and painless process that gives me crucial information about how your body is coping. With your permission, I can begin these checks now. Is that okay with you?
Yes, that's fine. Please go ahead.
Thank you, Mihiraa. I'll be as gentle as possible. While I'm doing this, let me just quickly summarize everything we've discussed so we're both clear. You came in today with stomach pain and vomiting that started after you ate out, and you haven't been able to keep water down. We've talked about how this is likely food poisoning, where your body is reacting to a germ in the food, and that these symptoms often improve within a day or two. We've also discussed the plan, which includes checking your vitals now, and then likely starting in 4-drip for fluids, along with medications for the nausea and pain. Finally, we went over some important safety tips for your recovery at home, like watching for signs of dehydration and practicing good hygiene, as well as some advice for being cautious with food choices when eating out in the future.